Good morning, everyone. Welcome, and thank you for this opportunity to share with you our work at Aheza Fortified Food. My name is Wendy Leonard, and I am the founder and executive director of the Ihangane Project, a nonprofit organization achieving lasting improvement in health outcomes in Rwanda. Aheza Fortified Food is a social enterprise launched by the Ihangane Project in 2015 with the goal of generating revenue to cover the costs of clinical care and to expand our impact beyond the clinic walls. The mission of Aheza Fortified Food is to eliminate childhood malnutrition in East Africa. In East Africa alone, there are nearly 7 million children suffering from malnutrition at this very moment. The children who do survive carry the repercussions of malnutrition into their adolescent and adult lives. In fact, the negative impact of malnutrition on public health and economic development is estimated to cost over $3.5 trillion every year. In Rwanda, 44% of children under 5 years of age suffer from malnutrition. These numbers are even worse among vulnerable subpopulations. Fortified food, especially during pregnancy and through the first 2 years of life, has a profound impact on a child's ability to grow, learn, and thrive. The World Health Organization recommends that food supplementation include protein, carbohydrates, micronutrients, and lipids to support healthy childhood development. And multiple studies demonstrate that fortified food distribution works. The Rwanda Ministry of Health recognizes these benefits, and they recommend free fortified food distribution to all those who are at highest risk. In particular, this includes HIV-positive pregnant women and their young children. In the clinical program that the Ihangane Project supports, we provide fortified porridge to 300 HIV-positive women and their children each month. And we have seen rates of underweight and stunting drop by over 60% in the first 3 years of the program. Unfortunately, there are challenges to these interventions. Many health facilities are dependent on donated products that can be unreliable and unsustainable. Commercially available products are unaffordable, and lower cost, lower quality alternatives are associated with the stigma of poverty. But we have a solution. Aheza provides a fortified porridge that prevents malnutrition and is commercially available at a price that is accessible to low-income and rural families. And we know it works. In just 1 year since shifting to Aheza fortified porridge, we have been able to eliminate cases of severe underweight malnutrition in our clinical program. So why Aheza fortified porridge? Our highly nutritious product contains all the nutrients recommended by the WHO for healthy childhood development. Aheza is in the final stage of S mark approval, the top quality mark from the Rwanda Standards Board. Aheza is 45% less expensive than its competitors and is the first to be commercially available in rural communities. And Aheza is delicious. In blind taste tests against other commercially available products, Aheza was consistently superior in taste, aroma, and quality. It is now associated with a positive image that encourages continued use. And it's allowing us to expand our healthcare reach. Profits from Aheza sales allow the Ihangane Project to subsidize the cost of clinical care to the most vulnerable in the community. We are particularly proud of the impact that we are seeing at each step along our supply and value chain. We began this process by understanding the supply chain from farm to factory to markets to ensure a high quality, safe product and a sustainable social business. Since 2013, the Ihangane Project has been working with HIV-positive farmers to improve their crop yields. Aheza Fortified Food now purchases raw materials from these farmers. In 2016, nearly $10,000 were reinvested in the local community through local purchase of maize, soya, and sugar. Local production allows us to keep both production and transportation costs low. We now sell nearly 1 metric ton to rural families each month simply by word of mouth, and this represents a 300% increase over the past 6 months. Over 500,000 servings of Aheza were distributed in 2016, and this translates to preventing malnutrition for over 8,500 children. And the Ihangane Project benefits as well. We purchase a heza at the cost of production, which allows us to decrease our costs by 63%. 75% of those costs have been further subsidized through the profits of a heza sales. In July of 2015, we inaugurated our porridge production facility. By November, we were producing 100% of the porridge required in our clinical program. When community members learned of our product, we began receiving requests for sales. We entered the local market in July of 2016, and we expanded into the larger market of Kigali, which is the capital of Rwanda, in June of 2017. We plan to expand throughout East Africa by 2021. Our unique sales strategy provides a distinct advantage over our competitors. Rather than focusing on direct-to-consumer sales, our priority is on bulk sales. We have 3 priority products. Our first is a heza fortified porridge in bulk, which is primarily sold to customers who purchase fortified food and distribute it to vulnerable populations. Examples of these customers include hospitals, nonprofit organizations, and government entities. Second product is a heza fortified porridge in bulk at wholesale prices, and this is sold to customers who resell directly to consumers. Our third product is fortified maize flour in bulk. This is a new product that we will begin selling this fall. These customers currently distribute unfortified maize flour to high-risk groups. This customer segment is primarily made up of primary and secondary schools. Our target market throughout East Africa is nearly 300,000 public and private sector organizations who distribute or sell fortified products and who could easily incorporate a heza into their product offering. If we achieved 100% penetration of our target market in Rwanda alone, we would reach 20,000 customers. To reach our projected goal, we only need 200. This number will further decrease with increasing numbers of consistent large volume sales. So how does the pricing work? Well, let's walk through the pricing for fortified porridge. It currently costs us 430 Rwandan francs or 50 cents to produce 1 kilogram of a heza fortified porridge. We sell this to our first customer segment, those who distribute the product for free and those who purchase in smaller volumes, for 850 Rwandan francs per kg. We sell this to resellers who will purchase in volumes of over 1 metric ton at a wholesale price of 500 Rwandan francs. And the suggested retail price is 1,000 Rwandan francs per kg, which is 45% less than the main competitors. The pricing for fortified maize flour is even more competitive since we will be able to sell this at a price point that is actually lower than most unfortified versions of the same product. Our margins will further improve as we implement our strategic initiatives to decrease production costs. As you can see here, we plan to scale production and sale of both fortified porridge and fortified maize flour over the next 5 years. What will not change is the amount of fortified porridge that the Ihangane Project will need to purchase at cost for a clinical program. This percentage of total sales will dramatically decrease over time. This slide demonstrates how we will break even as we move forward. Beginning in 2019, Aheza will achieve a sustainable business and begin paying off investments received in the 2 previous years. Across the board, we are equal to or exceed our competitors in these 7 key areas. Our biggest competitor is Africa Improved Food. We are confident in our competitive advantage because of our high-quality product, affordable pricing, and our strong partnerships. The Rwanda Ministry of Health considers us to be one of their key partners in their national strategy to eliminate malnutrition and recently extended our MOU for an additional 4 years. The stable supply chain is challenging for all companies in this field because of fluctuating maize prices. Our strong relationships with local farmers provide us with a particular competitive advantage. Another key advantage includes our highly dedicated team of experts. Diane Uwamahoro, our food production specialist, has led our efforts from the beginning, building the factory, ensuring a high-quality product, and coordinating both the supply chain and marketing aspects of the business in collaboration with her colleagues. We have identified 4 strategic initiatives that will help us to achieve our goals for scale. Our first initiative is to stabilize the supply chain. To ensure low cost of raw materials, we need to purchase large volumes of maize during specific times of the year. Our goal is to decrease the cost of production by 20% by optimizing our ability to purchase large volumes of grains at the lowest possible prices. Our second initiative is to strengthen internal operation processes. Our third is to expand marketing to support our scale strategy. And our fourth initiative is to invest in the staff and equipment needed to scale production and operations. AHESA is seeking $200,000 in grant and debt funding in 2017 and 2018. Grant funding will be used to invest in the staff and equipment needed for scale, and a revolving credit line will allow us to maintain a stable reserve of raw materials each year. This will allow us to provide 20 million servings of fortified food by 2019, thus effectively preventing malnutrition among 340,000 vulnerable children in the same time period. These early investments will support 600% growth in production and sales by the end of 2021. We aim to pay off our debt investments within 3 to 5 years. With this initial funding and sales growth, we will have the capacity to extend our impact to a total of over 1 million children by 2021. We invite you to partner with AHESA Fortified Food. We have a successful business model that is designed for scale, guaranteed social impact, and a team with a proven track record for delivering amazing results. Thank you so much for your time today.